Mifepristone, also known as RU486, is a medication used to end a pregnancy during the early stages, up to week 10, or 70 days after the first day of your last menstrual period. This medication works by blocking a natural substance called progesterone, which is necessary for the pregnancy to continue. It is usually taken together with another medicine called misoprostol. It's important to note that mifepristone should not be used if you have an ectopic pregnancy, as it will not end the pregnancy and may cause serious complications. When taking mifepristone, it's crucial to follow the prescribed dosage and timing recommended by your healthcare provider. Before taking mifepristone, make sure to read the medication guide provided by your doctor. You should also sign the patient agreement form and keep the guide handy for future reference. This treatment requires at least 2 visits to the doctor's office for important examinations and must be done under direct medical supervision. Your doctor may order an ultrasound to confirm the pregnancy is less than 10 weeks and not ectopic. Take mifepristone by mouth as directed by your doctor, usually as a single dose. After taking mifepristone, your doctor should direct you to wait 24 to 48 hours before taking another medication, misoprostol, by mouth as a single dose. It's crucial to follow your doctor's instructions carefully and return for a follow-up visit within 7 to 14 days after taking mifepristone, even if you are not having any problems. Remember not to eat grapefruit or drink grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely, as it can increase the chance of side effects with this medicine. It's important to note that heavy vaginal bleeding does not necessarily mean the pregnancy has ended. If the pregnancy has not ended, or there are serious medical problems, surgery may be needed. If the treatment fails and the pregnancy continues until birth, there is a risk of birth defects. If you experience nausea, vomiting, diarrhea, weakness, or dizziness that lasts longer than 24 hours after taking the second drug, seek medical help immediately. Bleeding and cramping are expected during this treatment, which may last up to 30 days and may be heavier than a normal period. If you experience heavy bleeding, fainting, fast heartbeat, or severe abdominal pain, seek medical help right away. It's important to attend all follow-up visits with your doctor and to report any worsening symptoms. Remember, this medication has been prescribed because the benefits outweigh the risks, but it's important to be aware of any serious side effects and seek medical help if needed. If you experience a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. And as always, if you notice any other effects not listed, contact your doctor or pharmacist for further guidance. Serious medical problems can occur when a pregnancy ends, such as infections and bleeding. It's important to read the medication guide, sign the patient agreement, and consult your doctor if you have any questions. If you are in the United States, you must follow the requirements of the Mifepristone REMS program to receive this medication. Your doctor will also give you clear instructions about who to call in case of an emergency, such as severe bleeding or infection. If you experience symptoms like severe abdominal pain, fainting, fast heartbeat, or fever lasting more than 4 hours, seek medical help right away as it could be a sign of a serious infection. It's also important to seek medical help if you experience continued heavy bleeding or feel sick more than 24 hours after taking the second drug, misoprostol. This could indicate a need for surgery or other medical care. Remember to show the medication guide to any healthcare professional you see, so they are aware that you are trying to end your pregnancy. Before taking mifepristone, make sure to inform your doctor about any allergies you may have, as well as your medical history. If you are using an IUD, it should be removed before starting mifepristone treatment. It's important to have easy access to emergency medical services while using this medication, as it may cause dizziness. Avoid alcohol and marijuana while using mifepristone, and do not drive or operate machinery until you know how it affects you. Mifepristone usually causes fetal death, but in rare cases, an ongoing pregnancy may occur. It's important to use birth control after treatment is completed, and consult your doctor for more information. If you are breastfeeding, consult your doctor about whether you should discard your breast milk for a few days after treatment, as the effects of mifepristone on infants are unknown. It's important to be aware of potential drug interactions when taking mifepristone 200 mg tablet abortifacients. Certain medications can affect how mifepristone works, or increase the risk of serious side effects. For example, long-term corticosteroid therapy, antiplatelet drugs, NSAIDs, and blood thinners may interact with this medication. Aspirin, for example, can increase the risk of bleeding when used with mifepristone. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Other medications can also affect the removal of mifepristone from your body, which may impact its effectiveness. These include azole antifungals, macrolide antibiotics, and drugs used to treat seizures, among others. Additionally, mifepristone can slow down the removal of other medications from your body, which may affect how they work. It's important to discuss all the medications you are taking with your doctor to ensure they are safe to use with Mifepristone 200 mg tablet abortifacients. If you or someone else has taken too much Mifepristone and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe vaginal bleeding. It's crucial to act quickly in these situations. While taking Mifepristone 200 mg tablet, you may need to undergo lab tests or medical examinations, such as ultrasound. It's important to attend all scheduled medical and lab appointments. It's also recommended to consult your doctor for more information on this. Make sure to follow the dosage and appointment schedule given to you by your doctor. If you happen to miss an appointment, be sure to reach out to your doctor as soon as possible. This medication can only be obtained from your doctor and should be stored at room temperature away from light and moisture. It's important to keep all medications out of the reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.